Hello, I'm Gregory Smith, and I serve as the treasurer for the Colorado Healthcare Ethics Forum, sometimes known as CHEF. I want to welcome you to this preview of our CHEF annual conference, which will be held Thursday and Friday, May 24th and 25th of this year. Our theme this year is Healthcare Professional Moral Distress, Burnout, and Solutions. The conference will be held at the Wellshire Event Center in Denver. Today, we are excited to have with us one of the speakers at the conference, Dr. Michael Victoroff. The title of his presentation is, "Are 400 physician suicides per year a morally acceptable cost of our healthcare system?" This question will be answered when he speaks at 9:10 a.m. on Wednesday, the 24th. Welcome, Dr. Victoroff. We are glad to have you with us. Would you tell us a little? Thank you. Would you tell us a little of your background and your work?
Well, I started out as a family doctor, and I pretty much was in direct patient care for about 20 years. Along the way, I was lucky enough to do a fellowship in biomedical ethics, and so I've kind of kept my finger in the ethics business for all of that time. I've worked in quite a few jobs. Since moving out of primary care, I've worked in medical education, delivery system management, other forms of direct care. Right now, most of my work is in clinical informatics and patient safety. I work at Copic, where most of what I do has to do with liability and risk management for health information.
Thank you. Would you share with us the focus or purpose of your presentation?
Well, I'm trying to fit in with the theme of the forum and explore some of the factors that have created a very obvious surge in dissatisfaction and unhappiness among healthcare workers, especially over the last few years, at trying to look at doing a causation analysis.
So, how will the participants benefit from attending your talk?
Well, I'm going to, try to keep it short and sweet, or at least short. I think most of the attendees are going to be familiar with the general concept of intrinsic versus extrinsic causes of burnout. The intrinsic causes would be things that just come with the job. This is medicine. You signed up for it. You're going to work at night. Babies don't come at convenient times. People get sick. Kids vomit. And sometimes people die, and sad things happen. And these are the things for which it's perfectly appropriate to talk about personal resilience. I call this the yoga and broccoli aspect of dealing with burnout. But most of the healthcare workers that I talk to these days who are distinctly unhappy are much more affected by what I call extrinsic causes. These are not things you signed up for when you wanted to go into doctoring or nursing or being a radiology tech. These have to do with, for the most part, the perception of injustice, dysfunction, non-working, ineffective, inefficient, or outright corrupt activities in the organizations where we all work. And I want to talk about the way I use the word corruption. It's not just there are mafia people all over. That's not it. It's more subtle. This is an ethics audience. They can understand philosophical nuance. For me, a corrupt organization is one whose operations contradict its mission. So if we claim to have a mission of healing and helping, and a lot of the operations that we do during the day really don't seem directly connected to that, then I think that we've got, dysfunction or corruption. This is something we need to fix ethically, as well as practically. And a lot of the folks I hear who are and I hear from people all the time who are quitting, retiring early, changing jobs, giving up. It's because one of the strongest human emotions that we can suffer from, most unpleasant emotions, is the perception of injustice to ourselves or someone we're standing by and watching. And I think that that's one of the things we need to analyze when we look at ways to improve the organization's institutions. And just not to give too much of a spoiler, but I'm going to ask a really confrontational question. For years, we have talked in the ethics community about how going on strike is inherently unethical because we're abandoning the needs of the communities we served. And I'm going to reverse that and ask this question: when would not going on strike be unethical? And hopefully I'll be able to build a good enough case so that at least some folks in the audience will feel supported in their perception that it's really time for reform.
Well, thank you. And I can see that you see there may be a disconnect between what a person thought of when they joined one of these helping professions and what actually happened when they were working in it. Is there anything else you'd like people to know about your presentation?
Well, I'm trying to walk this delicate line between being constructive and being a critic. We've done that before in the ethics world. I don't fear that this audience will mistake what I'm trying to accomplish. I guess my biggest concern is just that when we leave the kind of protected environment of the philosophical bubble, and we actually have to go back to work and talk to the practical folks who want workable answers. We really need to be able to take something to them. I'm hoping we'll be able to come up with some things.
Great. Well, thank you very much for taking time out of your busy schedule to give us a sneak preview of your talk focusing on physician suicide to be given at the Chef Annual Conference at 9:10 a.m. on Wednesday, May 24th. I encourage everyone who's listening to go to the Colorado Healthcare Ethics Forum website for more information and registration details for the conference at the Welshire Event Center in Denver, Colorado, May 24th and 25th. Registration is open right now. This is your opportunity. Thank you very much.